Well, oh, no, okay. We're being recorded. Okay, great. So I'm very happy today to have the opportunity to introduce my good friend and fellow Midwesterner, Ben Light, where it doesn't get 110 plus degrees. Ben Light, VP of Partnerships at Zorro. Zorro helps clients and, of course, brokers like us and our clients by providing an easy to use and intuitive and both employer and employee friendly ICHRA platform and solution that I think you will hopefully all be impressed by. Employers really use Zorro's tools to determine the right amount to spend on healthcare. And of course, employees use it to determine how to allocate those healthcare dollars from their employers. So um, it's a great tool, and I'm really excited to share this with you today. So without further ado, Ben, why don't you take it from here?
Great. Yeah, thank you so much. I really appreciate it. Before I bring up the slides and share the screen, we have a pair of Zorro socks, these beautiful socks available for the first person who successfully puts in the chat what ICHRA actually stands for. Speaking of the chat, please use it to put questions in. I don't want to be talking at you for the next 54 minutes because I definitely want this to be an interactive session. So ask questions, make sure that we're covering the things you want to cover. So what I'm going to do is share my screen for you, and we'll go through this presentation and talk a little bit about ICHRA. There we go. Let's look at it in slideshow mode. There we go. Okay. So I'm glad that people are asking about it because we at Zorro spend all our time talking about it and focusing on it. So let's talk a little bit about how we got here. And I'm going to talk about it in two ways. Here being how we arrived at where we are in the ICHRA world, but also how we got here from the crisis that we see of affordability in this country. So you can look at the different headlines that are shown here. We know how much the impact of people's health can have on their financial wellness. There's terrible statistics on the small amounts of money that would put people into bankruptcy, and we know the top reason for that in many cases is an unexpected health incident. But when talking about ICHRA for a second, let's rewind back to 2016, at the end of the Obama administration. One of the last acts they did around the Affordable Care Act was to create what's called the QSARA. So for those who are familiar with health insurance and the industry, you know we love our acronyms. The QSARA is the Qualified Small Employer Health Reimbursement Arrangement. That was created with the idea that people want to give money to their employees to help support the purchase of insurance. You say, well, they could always do that. Right. But what this did was to make it so it was a tax-free reimbursement. Now, the QSARA had a couple of limits on it. You could use it for only up to companies with 49 employees. You could only give up to certain amounts of money. There were limits on the contributions, and there were limited number of categories that you could slice people into. The Trump administration in 2019 actually expanded on the legislation and ended up creating the ICHRA that started January 1st, 2020. The three biggest changes from the QSARA to the ICHRA are that you can now use the ICHRA for companies of any size. You have no limits on the amount of money that you can give to people. And there are now 11 categories that you can use to put people in classes and give different amounts of money. So it's a much more flexible tool and puts people more in control of how much they want to give and how they control their insurance. So we know from the prior slide, we know people are having lots of challenges, and we know the cost of health insurance has risen tremendously. We're looking at a 10-year spread here, and you can see on the left for family coverage going from $16,000 up to almost $24,000 on average, which with a huge chunk, that employer contribution now represents on average more than the entire premium was just 10 years ago. And, when we talk about the ICHRA and the impact that it's having, here's just a little comparison to run through to understand a traditional group plan versus the ICHRA. So at the top, defined benefit versus defined contribution. Some of you might have heard ICHRA described as the 401k of health insurance. If you rewind back to the 70s, when everybody had a pension plan and no one had a 401k, or no one had even heard of a 401k, a very small piece of legislation comes out and creates the 401k. And now, fast forward to today, almost everyone has a 401k and is able to take the contribution that they get, add to it, and invest on their own. Similar, the ICHRA allows that employee to have that sort of choice, not on an investment, now on the plans that they pick. The second one, and I'm not going to run through all these in detail, I just want to highlight a couple. But the second one, participation, we see a huge issue around groups that have low participation and are struggling from their group carrier in order to meet those minimums. And as a result of that, they are unable to get coverage. The ICHRA, because it uses the individual market and people enroll in individual plans, if you have a group of 100 people and 5 of them want coverage, no group carrier is going to touch you, but the individual market will. In comes the ICHRA. So it provides employees with lots of choice. It gives them a huge number of plans. The employer gets a lot of control over the budget. These are plans that people enroll in individually so they can take them with. You're spreading your risk over a much larger population. And of course, I mentioned before, there's 11 different classes you can slice people into. So I had mentioned before the growth of the ICHRA, and I just want to talk about it. And look on the left and you can see what the growth rate is for larger employers. There were a number of people who thought from the beginning, oh, ICHRA is just going to be for smaller organizations. But we're actually seeing a lot of larger organizations who have employees in multiple geographies throughout the country who are wanting to offer choice and to get out of the risk business. And they're coming to ICHRA and they're saying, you know what, this really makes sense for us. Not just as a tool of last resort when they get a 40, 50, 60% increase, but as a real strategy. The other thing is, there were thoughts that people were going to only have the oldest and sickest among us who would be enrolling in an ICHRA or a QSERA. But if you look at the chart on the right, that actually isn't true. You're seeing lots of younger and, in theory, healthier people. So if you look at these second and third bars, who are enrolling in coverage through an ICHRA, which is bringing more younger, healthier people to the individual market, which will continue to put that downward pressure on those rates, which is just what we wanted to. So let's talk a little bit more in detail about an ICHRA and what you need to do in order to think about whether or not it makes sense for you. So there are a number of different things that you as an employer are probably thinking about as far as what's important to you when you're offering benefits, whether it's containing costs, adding or people to the plan if you want more, recruitment and retention, and if you're on a self-funded plan, maybe trying to reduce the different layers of administration that you have to go through. A lot of modern employers have people spread throughout the country and are struggling at times to find a plan that's going to meet everyone's needs. And as I mentioned a couple of times, and I'll continue to say, many people want to get out of the risk business. So at first, when you're considering what you want to do and whether or not an ICHRA makes sense, you've got to think about what your priorities are for your plan. If your priorities fall into any of these categories, ICHRA probably is going to make sense for you. The next step is going to be figuring out how to build your allowance model, how to allocate the funds that you're going to give to your employees. So on the left, you'll see the 11 different classes that you can split people into in order to give people money through the ICHRA. The three most common we see are geographic. So if you have people in different states, People are giving different amounts to those in different states, but they're giving them equal buying power because what they're able to do is to set an allowance model that adjusts by state, knowing that the costs in those states are different. The other two of the top three are full-time, part-time, and hourly versus salary. And what we see sometimes is people are looking at that recruitment retention with that part-time category and offering people, maybe they're not doing a full offer of coverage in the way they are to the full-time employees. Maybe they're not paying for 80% of the individual plan, but they're saying, we're going to give everyone an average of $200 a month for part-time employees. And in an era where we know it's hard to recruit and retain, that can make a lot of sense. So what you're seeing on the right is a tool that we have to help figure out how you're going to distribute the dollars that you're going to allocate to your employees. For anyone who's ever interested in seeing it, you'll get my contact information at the end, and I'm happy to run through it. Today is more about ICHRA conceptually, not just about Zorro. Now, the third step is going to be about change management. When you're converting to something like ICHRA, it's a really different way to do things. It is different because people are very accustomed to the process of my employer picks the carrier, my employer picks the plans, and I get a choice of 2, maybe 3, maybe at most 4 plans that I have to pick from. I check the box, I move on. ICHRA is very different in the sense that an employee could have 50, 60, 70. In my area, I've got 135 plans available to me when I go shopping. So first of all, you're telling people this is a different way to do things. So communicating up front.
We're doing it right now.
Sorry, was there a question? Oh, okay. Sorry, I thought someone was asking a question. So communicating up front is really important. And it's important not only because you want people to understand what it is that's happening, but you also need to communicate per the regulations. There's a 90-day notice you're supposed to send out before your ICHRA starts. And you want to communicate to people, here's the reimbursement amount, here's how we're going to help you select coverage. And there's lots of different tools and resources available for that. I'm going to get to that in a second. You want them, to know when the ICHRA is going to start, what the enrollment deadlines, and you want your broker to be a partner for you in managing this change. This is something that you have to be very focused on, because if you just assume, okay, we're going to turn it on and let people go, people will not have a great experience. The best ICHRAs that I've seen implemented are those where it's a real partnership between the employer, the broker, and the ICHRA vendor who's helping to manage everything in the background and become the ICHRA source of truth for you as an employer. After you've made the decision, you've educated your employees, you've helped them understand what's the ICHRA, how are we, gonna roll this out. One of the biggest questions that gets asked is, well, if there's 40, 50, 60 plans, how is it that my employees are going to figure it out? So you want to think about working with a partner who has support to help those employees pick those plans and make those choices. At Zorro, we've got an AI-driven decision support tool that employees enter their information. They provide information about medications or particular doctors that are important to them. They talk about how much they use their insurance, and they get some recommendations based on what they've entered into the system. And then also have access to a bunch of filters that allow them to pare down the options that are presented in front of them. But this is a big area where I know employers are concerned because they're worried that their employees are going to have a hard time picking plans. Those of you who've talked to me about this before might have heard me say this. People pick their own homeowner's insurance, they pick their own car insurance, they pick their own pet insurance. They're capable of picking their medical insurance with the right support. And not only are there tools to do it, but often we'll be able to get an employee on the phone with someone as well, with a licensed, trained enrollment counselor who can help them to make that decision and take the dollars that their employer has allocated to them and figure out how to spend them appropriately. Another thing that people got very caught up on when ICHRA first came out, so let's go back to 2019, the ICHRA legislation gets put into effect. It's going to start January 1st of 2020. I actually at that time was working for a broker here in Cleveland, and we started talking to our clients about the process of the ICHRA and how it worked, especially clients who had low enrollment numbers, and we were working with a large group at that time. And they got very caught up on the R in ICHRA. They said, hang on a second. This is reimbursement, meaning you're going to ask our employees to pay their own premiums in full, and then we're going to reimburse them? Well, what if someone's got 2 or 3 kids and their premium's $2,500 and they make $18 an hour? They're never going to be able to afford that. So a lot of people paused very quickly on the ICHRA because of that. As a result, payment solutions were developed. So what you're seeing in front of you is a way in which we handle a payment solution where the employer would do a single bill, would pay on a monthly basis the full premium for all employees, put that into our payment system, and then we slice it up by each employee. And that money then gets sent to each individual carrier where those employees are enrolled in coverage. Some get a virtual debit card, some through an ACH. It just depends on what the carrier takes. But what this does is a couple of things. First of all, it takes the financial burden off of the employee and puts it back onto the employer. So the monthly float of the premium is the responsibility of the employer, who's in a better position to handle it. Second, it allows the employee who potentially has overspent the allowance that they've been given to do that allowance via payroll deduction. They're very accustomed to doing that today, so they can do it in this way. And then when the employer sends the money to us, what happens is they're sending their portion and the employee's portion for it to go and pay that full premium. The last thing is it makes the employee confident that those premiums are being paid, and it makes the employer confident in it as well. So when people started to question the reimbursement process of the ICHRA, one of the questions was, well, if I give people this money as a reimbursement, how do I know they're spending it on insurance? Well, we've eliminated that with the payment solutions because that money is going directly to the insurance carrier. So you don't have to worry that someone either isn't paying their bills and is going to have their coverage canceled, or they're taking that money and spending it on something else. And then finally, I'll pause here for 1 second and say, I believe that every successful ICHRA has 2 things in common. One, people are successfully enrolled in coverage, and 2, the employer is getting timely and accurate data. Because in order to manage your ICHRA, you want to make sure you know who's enrolled, how much are you giving them, how much do you need to deduct from their pay. You want to make sure that all the premiums are being paid. You want to have access to the system where everything's being administered. You want to be able to see the payments going on in the background. And you want to make sure from a compliance perspective that everything's being handled. You know, there's the 1094, 1095s that still need to be handled. There's something called the PCORI that anyone who's on an HRA has to pay. It's a tiny little fee that gets paid every year. But still, you want to make sure that all of this is happening and happening successfully. So administering your plan is really important, and it's a slight difference from how you administer your plan today. So working with a partner who's got the tools to help you administer is really important. So when picking a partner, here are some things you want to think about. And before I jump into this, I'm realizing I can't see the chat. So let me just go back and look for 1 second to see if I'm missing any questions or if someone wants to tell me whether or not I am. Are there
No, you're
questions?
good.
Sorry, I'm good.
You're good.
Awesome. Okay, let's go back to slideshow mode. Okay, so when you're picking a provider, here are some things to think about. First of all, I mentioned the process that you want to go through with the sort of culture change. Onboarding onto the system needs to be easy. You upload a census, you make sure that all the information is accurate, you've built your allowance model along with guidance from your broker and your ICHRA partner, and you feel comfortable and confident that you're going to get the information you need. Second, the payment process has to be smooth and easy. The One of the biggest differences in the ICHRA world is all of the payments are now made individually. So you have to have a payment process that allows visibility, not only to be able to see that the premiums are going through, but then so it can be transparent to you so you can know if a payment got missed or it was for the wrong amount, that you can see it and that someone is making sure that that's being resolved. You want to make sure that your employees have the ability to get support through the enrollment process. There are, as I showed you on our platform, we have this data-driven decision support tool that helps employees to make a decision when picking their plan. You want to be able, we talk about the seamless administration. You want to be able to put yourself in a position where you have the right data, payroll reports, a list of who's enrolled in what plans, names of carriers, amounts of money that is the full premium, your contribution, the employee's contribution, because employees are going to come and ask those questions, even though they're going to get access to that information and they've picked that plan. Inevitably, they're not remembering it. They didn't keep that email. They can't find that email. They can't, they've lost their password to log in to the carrier portal. So you're going to need that information and access to that to be able to answer some of those questions. On the fully insured group side, often you're able to log right into a carrier system, print out a temporary ID card and give it to the employee. Now you're going to have people enrolled with all sorts of different carriers and you're no longer the administrator, but you'll still have the ICHRA information to be able to say, okay, have you gone to your carrier? Well, and the employee says, well, who did I enroll with? Remember, you picked Capital Blue. Oh, okay, great. Send them to the Capital Blue website. Make sure they enroll. Make sure that they download that temporary ID card. You'll be able to provide them with that input, but only if you have that data. Make sure you've got an ICHRA partner who's there to provide service to you with a customer support team and a dedicated team that's there to support you throughout that process. And then, as I mentioned before, compliance, making sure your ICHRA is designed in a compliant way, making sure your classes are set up correctly. There are rules around the allowance model. So the allowance model has this rule that you're only allowed to give your oldest person 3 times more than what you gave your youngest person. So if all of a sudden someone sets up an allowance model and an 18-year-old gets $100 and a 64-year-old gets $1,000, that is not a compliant reimbursement structure. You want to make sure it's designed in a compliant way. If you want affordability to be taken into account, if you don't want to pay what's called the shared responsibility payment, all of these things need to be factored in. And so you pick a partner who understands this and can help you work through all of these questions and make you confident that you've set up a compliant ICHRA. Okay, let's jump back for a second and let's go back to the Q&A. I'm going to stop the share for a minute. Okay, so feel free to unmute or to put questions in the chat. Does the ICHRA make the employee ineligible for a subsidy? Lauren, thank you for the question. It's a great question. So for those who aren't seeing it, the question is, does the ICHRA make the employee ineligible for a subsidy? There's 2 ways that you can make an offer to an employee. One is you make an offer that is considered affordable per the technical definition from the government. So what it would mean is for 2024, that offer would make the employee portion of the premium less than 8.39% of their gross household income. If you make an affordable offer of coverage, the employee is not eligible for the subsidy, for the advanced premium tax credits. If you make an unaffordable offer of coverage, the employee is eligible for the tax credits. And then if they take those, then you as the employer will get a bill for the shared responsibility payment, or as some of you know, either the penalty B or what's called the tack hammer. And if you do that, the payment for 2024 is about $372 a month. My assumption is it will go up about 3% for 2025. If you look back historically, it's gone up about 3% a year. I will throw in one wrinkle to this, which is in 2023, the government fixed what's called the family glitch. The family glitch said that if you got an affordable offer of coverage, you were not allowed to get tax credits for your spouse or dependents, even though that affordable offer of coverage was only for the individual premium. In 2023, that got fixed. And now, if you get an affordable offer of coverage just for the employee amount, your spouse and dependents can get tax credits for themselves, which means there are now situations where employers are making very generous offers to their individual employees, but doing an employee-only amount and not offering any additional amount for spouse, children, or families. So they are allowing employees to go get the tax credits for them. They then don't have to pay those. Lauren, I hope that answered your question. Okay, from Erica. Are ICHRA plans subject to the same pre-tax guidelines, open enrollment, qualifying event triggers? Yes. So the ICHRA, yes, still has the same pre-tax guidelines. Open enrollment, if you move to an ICHRA, open enrollment for you becomes November 1st to December 15th. That is the federal open enrollment period, and that's when people enroll in individual plans. When you add someone on, add a new employee on mid-year, the offer of the ICHRA creates a special enrollment period for them. So an employee who starts in June and should have coverage July 1 can enroll and uses the offer of the ICHRA as their special enrollment. They can, for qualifying events, marriage, birth, death, things like that. It also creates a life event, and they're able to add or drop people in the same way that they would under a group plan. Now, if they cancel coverage on their own, they are not allowed to add it back, because canceling coverage on your own is not considered a life event. But if they have coverage, say through a spouse's job, and that spouse leaves their job, and so they've lost access to that plan, then that is considered a life event and they can enroll. Okay, question from Nancy. Is the 90-day notice from the start of the plan year or the start of open enrollment? The 90-day notice is you are supposed to notify your employees 90 days before the plan starts. So if you are going to be a January 1st ICHRA, you should notify your employees October 2nd. So basically take the day you want coverage to go live for your group and back up 90 days. Okay, Lauren, can the dependent portion of the premium, if subsidized, or not be payroll deducted on a pre or post tax basis? So the dependent portion of the premium, if subsidized, meaning if they get tax credits, it actually won't be paid through the employer, because if they get tax credits, they're actually going to go on the exchange and do that directly. If you enroll in coverage as a whole family through the employer, yes, it is payroll deducted. One thing to say about pre or post tax, and I know this is a little bit of a wrinkle, but people do often ask this question. There are two versions of most plans in the individual market: on exchange or off exchange. On exchange are those sold through healthcare.gov or through any of the state exchanges, of which I believe there are now 18 states that are doing their own exchanges. Those plans are known as on exchange. Those plans are the ones you can get the tax credits with. In most cases, there is an identical plan that's called an off exchange plan that is sold directly from the carrier. When you're shopping on our portal, for example, through our shopping tool, you are seeing predominantly off exchange plans. Only if there is a plan that appears on an exchange only, no off exchange twin, would you see that on our platform. The reason why I tell you this is that if someone buys an on exchange plan, which sometimes they do, and they overspend their allowance. So let's say I buy an on exchange plan, it's $700, my employer is giving me $500. So I pay $200 of the premium. If I use a payment solution, and if I want to do my portion via payroll deduction, because I've bought an on exchange plan, my portion is post-tax. Still can come out through payroll, but it's post-tax. The reason why is the government doesn't want to think that you're double dipping and taking tax credits and getting the pre-tax benefit of doing it through payroll. It is rare that that happens, but it is just something to know. All right, so question from Brianna. If an employee enrolls in an ICHRA, regardless of affordable or unaffordable, the employee is not eligible for premium tax credits. Okay. Brianna, can you type a little more about that, or feel free to unmute? So I want to make sure that I'm answering the question right. I think what the question is asking is, if you are going through the ICHRA, affordable or unaffordable, the employee is not eligible for premium tax credits. If you get an unaffordable offer, you can turn down the ICHRA and go get the tax credits. Oh, got it. Okay, great. Other questions? All right, so I'm going to go back for a second to my presentation.
Ben, it's Lauren.
Yeah.
So Brianna's follow-up. So if the employer contribution towards the ICHRA still makes it unaffordable for the employee can turn down the ICHRA and
Yes.
still apply for the subsidy. But at that
Correct.
point, the employer would still be subject to the penalty, the ACA penalty.
To the Part B shared responsibility payment, correct. Yes.
Thank you.
If someone goes and gets those tax credits, then you'll get a letter as the employer saying, your employee claimed they got an unaffordable offer. Here's your bill for $372 a month for every month in which that employee is enrolled in coverage. Okay, let's go back. I have one more slide that I want to go over. Okay. So when the ICHRA came out, there were a lot of misconceptions, and really over the last couple of years, there have continued to be these misconceptions. One, how complicated it is, and employees won't be able to figure it out. So you heard me say people buy their own life, their own car, their own homeowners, and they know what's best for them. There are a lot of people who are overinsured today, who are enrolled in a plan that has a very low deductible and very low copays, and they don't really need it. They would be fine with a much cheaper plan with higher deductibles and higher copays. So they're able to do this, and with the right tools, they can. So again, I know I said this earlier, be sure that when you pick an ICHRA vendor, you're picking someone who has tools to help employees make those selections, and not only has the technology, but is able to support an employee with a live person if necessary. A lot of people can do it on their own, but some people want that extra handhold. One of the early concerns, and I still hear people saying it, is that employees are just going to buy cheap bronze plans, which basically equates to catastrophic coverage. They're going to have a, $8,500 deductible and a $9,450 max out of pocket, and God forbid they end up in the hospital. They're not going to be able to afford what it is that they're being charged. The data doesn't actually support that. So if you look at data from 2023, of the plan choices that people actually enrolled in. So for those who know the individual market, there's the 4 tiers: the platinum, gold, silver, and bronze. Loosely, they equate to paying for 60, 70, 80, and 90% of your care, but they are, in most cases, increasingly expensive. So if you look at the 3 on the right, the gold, silver, and bronze, you'll see it's a pretty even distribution between those 3. It isn't just that people grabbed that cheapest plan and said, oh, my employer's giving me $450. Here's a $446 bronze plan. I don't have to pay anything. I'm just going to take that plan. People are buying the plans that make the most sense for them. I do at times get questions from employers who are concerned that because people haven't heard of the ICHRA, when they're making an offer to a new employee, that employee is going to say, well, it seems like you don't even offer coverage at all. This actually happened to me recently. I was talking to a friend who's involved in a merger of 2 nonprofits here in Cleveland. And she said, well, this other organization, they don't even offer insurance. So they're going to take the insurance from the organization that they're merging with. And I said, not only does that first organization offer insurance, they offer an ICHRA. By the way, that's the thing that I do. Thank you for listening to me. People are concerned that because employees don't generally know the ICHRA and it's so new, that they're going to not look as highly on you. We believe it actually can be a tool to help recruiting. You make a generous offer of coverage. You are offering people choice in their plans, being able to pick their own network. A lot of people live in places that have sort of competing networks and competing healthcare systems, and sometimes it's hard to find one plan that covers 2 health systems. Well, what if you go to work for someone who covers the health system that your doctors aren't at? Now, with an ICHRA, you can pick the health system where your doctors are. Plus, that plan is portable. So when you leave that job, that's your plan to take with you. So it's really something that can be used when sold right as a tool to recruit and retain your talent. I know I talked earlier about how people got very caught up on the R and the fact that they were concerned that A, people wouldn't pay their premiums, and B, they wouldn't be able to. And so, we have these technology solutions, we have these payment solutions that help to make that a thing of the past, that helps to fund the premium, takes money directly from the employer right to the carrier on behalf of that employee. And then the last thing that was a common misconception is that only small employers were using the ICHRA. And I can tell you it's just not true. You can see the data there, about 171% uptick in ALEs, applicable large employers, who are using the ICHRA. What we're seeing, and I'm getting emails all the time with brokers who are coming to me with larger groups that have gotten a bad renewal, or they've got people all over the country, or they want to get out of the risk business, whatever the reason is. And they're saying, hey, we think ICHRA is going to be the right solution for us. So you're seeing many more large clients and large companies who are using ICHRA very successfully. And even some who have said, okay, we got a really bad renewal, so we're going to use ICHRA for a year as a bridge to the next time we go back to the fully insured or self-insured world. And then a year or two in, all of a sudden they're realizing, gee, this ICHRA is working really well. Our employees are really happy. They make an acquisition of a company that's in a brand new geography for them. And all of a sudden those people are all able to pick their own local plans. And there's lots of ways in which it's being, really successful. All right, so.
And I think we have some questions that have come in, and I know,
Yeah.
Ben, one of the questions were, what's the average increase has been the last couple of years on and off the exchanges, the plans in the gold, silver, and bronze plans, and that's historical. Where do you see it going in the next year or two?
Yeah, it's a great question. So go back to when the ICHRA started in 2020. The first 3 years, 2021, 22, the individual market was almost flat for those 3 years. So if you had a group that was even getting a 7 to 10% increase, the individual market was doing better. What I've seen the last couple of years are anywhere in the like 3 to 6, 3 to 7 range. The nice thing is, if you look at the number of people who are now in the individual market, 21.5 million people are in the individual market. Some of that is due to the changes in the Medicare eligibility. Some of that is due to the increase in tax credits that have come from the current administration, and the fact that so many people enrolled during COVID. So you've seen a huge increase in the number of people who are enrolled. And what that does is it spreads the risk and it puts downward pressure on those rates. All of the conversations that I have heard and the discussions that we've had with carriers who we've worked with, and by the way, we've had a number of large carriers who have reached out to us to say, look, ICHRA's a thing, we believe in it, we know it's not going anywhere. What can we do to help promote ICHRA conceptually? And in those conversations, they recognize that the individual market needs to continue to produce low single-digit increases in order to stay ahead of corresponding group plans. Because if you're talking about 10, 12, 15% increases and up on the group side, or 40, 50, 60 if you've had a bad year, 3 to 7, 3 to 6% is something people can absolutely handle.
And again, I'll encourage anyone who would like to submit a question using the chat feature. We'll go ahead and make sure we get that. Here's a few more that we have. Can an employer offer an ICHRA and group health insurance at the same time?
Yeah, it's a great question. You can offer them side by side. So imagine that you have a headquarters location in a place where you've got a group plan that you really like, a network that works for everyone. It's a very successful group plan. But you've got people in multiple other geographies where they might struggle being on that plan. What you do is you class out the people who are in the other geographies, you offer them the ICHRA, and you then keep the group plan for the headquarters location. You can do this. The thing you cannot do is offer both plans to the same group of people. So you can't give people a choice between, do you want the fully insured group plan or do you want the ICHRA? It's what's offered to the class that they're in is what they have available to them. And there are rules that we don't have to get into the details. I'm happy to follow up with people individually around, if you're offering those, there are minimum class sizes that you have to have. If everyone gets the ICHRA, there's no minimum on the size of class. But if you offer the fully insured group plan and the ICHRA side by side to different classes, you do have to just make sure that you've got classes that meet the appropriate guidelines.
Great, thank you. And more questions coming in. One, we know that change is always something that gives everyone pause. How easy is it for somebody to switch over to an ICHRA?
So I will tell you that there are different things you have to do to set up an ICHRA versus a fully insured group plan. I don't think they're any more difficult. They're just different. And there's a lot of steps you have to cover. So at the beginning, there's a little more of a lift. It's not that it's difficult. You just have to make sure you're covering all the steps, which is why you want a good partner and you want a broker who understands it. And then the other piece is, in the first couple months of the ICHRA, imagine you've got 100 employees, we would have submitted 100 individual applications. So we increase the likelihood of errors. But that's why I can tell you for Zorro, that's why we have software that watches out for these things and that sets off alarms if payments aren't made. And, so there are ways in which we can account for those things and just be prepared for the first couple of months until all of that's sorted out, and then everything can run pretty smoothly. I do see another question in the chat of the minimum group size that can utilize an ICHRA. Realistically, two. There's no minimum, but what I will tell you is setting up a group of 2 is the same amount of effort as setting up a group of 50. So in some cases, one has to figure out if it really makes sense for a group that small, because there are fees, we charge fees, broker charges fees, and you just have to figure out if it makes sense to do it.
Here's one. If an ICHRA really does make your coverage more affordable, wouldn't more employees opt in, and therefore would it cost more?
It's a really good question. And I go back to about almost 3 years ago, where we were working with a group. They owned nursing homes, and they had about 600 employees, 300 enrolled. The holding company that owned, their CEO said, "You're going to blow my budget out of the water." He was looking at the numbers and thinking, okay, even a reasonable offer was going to make a bronze plan almost free for people, and he was sure that everyone was going to take the coverage. In the end, for the 300 that were enrolled on the group side, 295 enrolled in the ICHRA, because what we have found is that people have coverage in one way or another. It's not that they're turning you down in most cases because they don't want the coverage, it's that they have it somewhere else. They have it with a spouse, they have it, they're former military and they're on TRICARE, they're under 26 and they're on a parent's plan. So what our data has shown, and I've seen this, I've been in the ICHRA world 3.5 years now and seen hundreds of groups that have onboarded. I've seen one group where the enrollment percentage changed significantly. The reason why is that group had offered a MEC plan previously. They went from a MEC plan to now fully insured plans with minimum actuarial value that were better plans. And so they did see more people who took it because someone's only option up to that point was a MEC plan. And they felt like, I'm not going to spend money on this plan. It barely covers anything. And all of a sudden they realized, oh wait, now I'm actually getting real coverage. So that was the one group that I've seen that had a significant variance in their enrollment percentage. Most will be up or down 2 to 3%.
And then you may have answered this question before or touched upon it, but when it comes to a company looking at this and saying, okay, do I need an ICHRA administrator? Can I administrate this on my own? What would you say to that? Why would they need an ICHRA administrator?
Yeah, so, it's a fair question. I think there are a number of things that you need an ICHRA administrator for. First of all, we're going to provide all of the documents that you need to set up your ICHRA, the 90-day notice. We're going to provide all of the infrastructure in order for the employees to shop. One of the things that people get very concerned about is, well, wait, how are my employees going to know what is a plan that's reimbursable through the ICHRA? So I've run across situations where employees shop through our platform, and then someone comes back and says, well, I see this plan out here and it's a lot cheaper and you're not showing it on your plan. Why aren't you showing this plan? Well, it's not an ACA qualified plan. Therefore, it's not reimbursable through the ICHRA. So we're doing that work to curate this for you and make sure that the plans that the employees are shopping from are ACA qualified plans and that you're eligible to reimburse them. The other thing is the payment solution is a big piece of this. There are times where people have said, well, what if I just, as an employer, use our checking account or my credit card to pay for everyone's plan, and that way I'll do it on my own? Well, that's totally fine, and that works right up until the moment that that employee leaves. And then all of a sudden, your payment information is in their account. And you have to count on them to go in and remove that payment information and not use it for anything else. Whereas the payment solution we have, when an employee leaves, you tell us, we shut off their individual card or account. So that goes away. So we're making sure that you're not paying inappropriately as an employer for that employee's plan. The other thing is, from an ICHRA reimbursement design perspective, you want to make sure that you've designed a compliant ICHRA. There are lots of rules you need to follow, and our system does it for you, and a lot of the systems do it for you. I think ours does it very elegantly, but you want to make sure that you are doing this in a compliant way.
Can dental and vision be included?
So there are some individual plans that actually include some dental and vision coverage. You'll see them when you're shopping. It'll say like plus D/V. There will be two plans that look almost identical, and there's a slight difference in the price. And it will generally be that dental and vision are included in that second one. The other thing is, if you as an employee enroll in individual dental or vision coverage, you're allowed to use your ICHRA allowance, if there is any left over, towards those, as long as they're individual coverage. What we're seeing with a lot of larger employers is they are doing ICHRA for their medical, and they're doing dental and vision still as group plans for people, because the rates don't change in the same way with those.
Great. And I'm looking to see if any more questions have come through. I believe we've answered them. Ask now if you wish to have it answered. Otherwise, we're going to be closing things out. Ben, thanks so much for all of that information. We truly appreciate it. As you can see on the screen, next week is when we'll have this available to everybody. Be sure to always check corpsin.com and the events page. You'll not only take a look at what on-demand webinars we have available, including this one next week, but you'll see what's happening, in the future. And, that's a great place for you to stay in tune. By the way, Lauren, I see one more question. That's fine. If
Yes.
you go right ahead.
Just one. So, Ben, am I correct in saying that an employer can basically make the employee contribution, the 8.39% for each employee? And I think for some employers that could actually save them money based on a single contribution on a fully insured plan, group health plan, couldn't it?
So you're saying that the employer goes like right to the affordability
Right.
for each person.
Right.
Yeah, it's tricky to do that for right to each person because the variance in ages and where they live, and it's based off of, the affordability is based off the low cost silver plan in their rating area. So generally, if they want to get to 100% affordability, there are going to be some people who are going to get an offer that will have them paying well below the 8.39%.
Thank you.
But they still could end up with significant savings. It just depends on where they are with their group plan and those rates.
Thank you.
Yeah, for sure.
Thanks, Ben. I want to call your attention to a couple things. One, as I said, anyone who requires SHRM or HRCI credits, we will make them available to you via email by next week. And also, please, if you have a few minutes, it won't take long. I put a link into the chat for everyone to see. That link takes you to our survey so that you can really give us good feedback on this, as well as I said, give us some ideas as to what you're looking for in the future. Take a look at our resource center. As I said, we're happy to bring all these insights to you. Our thought leadership is something that we take great pride in, and we will continue to invest in that and have folks like Ben join us to talk about the topics of the day. I want to thank you, Ben, and the whole Zorro team, and Dan Cooperstein who hosts all of these as it relates to these topics. Dan, I'll turn it to you if there's any last words that you need to share before we close it out.
Actually, I'm good. I thought, Ben, you did a great job. Thank you so much for joining us today, and hopefully we can do this again soon. Really enjoyed it. Thank you.
Great. I think what Ben was saying while he was on mute there is sorry that you all couldn't enjoy this Ohio weather where it's 83 degrees and no
Exactly.
humidity. That's
Well,
what I read.
I wanted to thank you for having me, and thanks everyone for the great questions. And one other thing, if you want to reach me, you can see my email there. I will give you one hint not to miss that we are .co, not .com.
There you go. Perfect.
That's a good one. That's good. Thank you.
Thanks, everybody.
Thanks.